I'm Dr. Sneha, consultant physician at Cura Hospitals. Here I am speaking about stroke. Stroke, also known as paralysis or a brain attack, is a sudden loss of brain function. There are two types of strokes. One is a hemorrhagic stroke, where there is a bleeding in the brain due to rupture of a blood vessel. Two, there is an ischemic stroke. This is 90% of the stroke is an ischemic stroke. Here, there is a block in the blood vessel. Usually we call it as there is a blood clot in the brain. Risk factors for stroke are diabetes, hypertension, high cholesterol levels, smoking, and various heart conditions and diseases like autoimmune disorders, cancers, pregnancy, and various bleeding blood disorders. Usually a patient with stroke presents with weakness of one side of the limb, either both the limbs or a single limb. They can also present with slurring of speech, mouth deviation, severe giddiness, swaying towards one side, walking difficulty, or some patients come with confusion, some patients present with seizures, some patients present with sudden loss of consciousness. Usually what we say is in stroke, time is brain. The key is as soon as the onset of symptoms have occurred, the patient has to be rushed to the hospital. Every single minute, millions of neurons are lost. So the patient has to be rushed to the hospital as early as possible. When such patients are brought to the hospital, these are the following investigations we do. First, most important is a brain imaging. We either do a CT brain or an MRI brain. If the patient comes to us within 6 hours, we usually first get a CT brain to rule out whether it is a bleed or it is a blood clot. But the more sensitive one, the more specific one is an MRI brain. We usually do something called a stroke package, which includes MRI brain as well as an MR angiogram. In MR angiogram, we get to see the vessels, all the intracranial vessels, and which artery is blocked and what is the percentage of the block in the vessel. The second thing that we do is we also screen the neck vessels. We have few blood vessels which can be seen in the neck. That gives the blood supply to the brain. So we do something called carotid and vertebral Doppler. The third important thing that we do is a cardiac evaluation. We do an ECG and if required, an echo. Other blood investigations that we do are we screen for high cholesterol levels, we screen for sugar, we screen for other bleeding blood disorders which can lead to stroke. Now, stroke is one of the commonest emergencies at all times. It causes it has caused a quite number of deaths and a severe disability in our population. So, like I said previously, time is the most important thing. So depending on the type of the stroke, we have a couple of modalities for treatment. It depends on the time. One is, it depends on the type. One is hemorrhagic stroke. If in the hemorrhagic stroke, the most leading cause of hemorrhagic stroke is hypertension. So the first thing we do is control the blood pressure. If the bleed is very large, then we involve a neurosurgeon to decompress if the bleed is very large, it is pressing the other parts of the brain. When the neurosurgeon intervenes and removes the blood clot. If it is due to AV malformations or if it is due to aneurysms, then an open surgery or an endovascular surgery can be done where they put a coil inside it and occlude it.
Cura Hospitals. Healing with care.